Welcome to the Abode University course on bloodborne pathogens and the universal precautions surrounding them. The purpose of this unit is to acquaint you with the bloodborne pathogens employees are most commonly exposed to in the workplace. The Occupational Safety and Health Administration, or OSHA for short, is the federal agency that advises and enforces safety regulations in the workplace. OSHA specifies both appropriate employee conduct and employer responsibilities mandated by the government. After discussing the risks presented by bloodborne pathogens, we will review what is expected of employees and their employer to maintain a safe work environment. Bloodborne pathogens are defined as the pathogenic microorganisms that are present in human blood or other potentially infectious materials and can cause disease in humans. Essentially, it is the bacterium, virus, or other microorganism that can cause disease and is transferred via bodily fluids. Common viruses. The Journal of Clinical Virology recently published an article identifying 26 different viruses to be responsible for most occupational transmissions. 3 pathogens in particular account for most cases due to their prevalence in patients commonly served: the hepatitis B virus, hepatitis C virus, and the human immunodeficiency virus, or HIV. Transmission concerns. Bloodborne viruses can survive outside the body in dried blood and other bodily fluids, though some viruses survive longer than others. HIV is not a particularly hardy virus. It cannot survive for more than 24 hours outside the body when exposed to air in the open environment. However, it is possible for the HIV virus to survive for up to 4 weeks inside the enclosed environment of a syringe. Hepatitis C, on the other hand, is very hardy. It can survive outside the body on environmental surfaces for up to 6 weeks. Bloodborne pathogens are transferred from an infected person to a healthy person when infected bodily fluids enter a healthy bloodstream. They are not transferred by sharing eating utensils, hugging, kissing, holding hands, coughing, sneezing, or through food and water. The highest proportion of transmission occurs through either sharing or being stuck by previously used hollow bore needles. So why is there so much concern surrounding bloodborne pathogens? By now, you should have a sense of how much of a risk they present in the workplace. Indeed, OSHA estimates that 5.6 million workers in healthcare and other facilities are at risk of exposure to bloodborne pathogens, such as the human immunodeficiency virus, or HIV, and hepatitis B. Having explained the risks surrounding bloodborne pathogens, we can now begin to discuss the best practices involved in minimizing risk. In a scenario where an employee or program participant falls and cuts themselves or begins bleeding in some other way, what should you do? What should your fellow employees do? We will discuss the appropriate response in this course. Best practices begin with what are referred to as universal precautions, whose purpose is to minimize risk and prevent the transmission of diseases. They are a set of standards to be used every day in the workplace, including treating all human blood and certain bodily fluids as if they are infectious. And they must be observed in all situations where there is a potential for contact with blood or other potentially infected materials. One should follow appropriate procedures when exposed to blood, vomit, and feces. Further practices include the appropriate procedure to follow when exposed to bodily fluids. Employees should wear personal protective equipment, whether that be gloves, eyewear, and/or gowns, given the requirements of their position. Please note that prescription eyeglasses are not appropriate protective eyewear. Employees should dispose of sharp objects in a puncture-proof container to ensure contamination does not spread. You should absorb fluids to remove them from the environment before attempting to sanitize the area with a disinfectant. Cat litter can be used to absorb large amounts of fluid. All materials used to absorb waste should be discarded in a biohazard waste bag, which should then immediately be taken to an outside trash receptacle. After having absorbed the bulk of exposed bodily fluids, you will need to sterilize the affected area with a disinfectant. The first step is to clean with soap and water, and then administer a disinfectant like a bleach solution. The bleach solution should be allowed to sit on the infected area for 10 minutes before being cleaned up. It can be made by mixing a quarter cup of bleach with 2 1/4 cups of water. When sanitizing infected areas, great care should be taken to not be injured during the course of cleaning. Injuries, such as a skin puncture by a contaminated object, require immediate medical attention and are a workers' compensation injury. In the case of injury, please see a workers' compensation physician as soon as possible. All injuries of any type in the workplace should be reported to the Occupational Health and Safety Representative. In the case of a BODE, that would be Paula Cartwright, our HR manager, located at the Fremont office. Before continuing with appropriate practices, we first must define a couple relevant terms, the first being occupational exposure. Occupational exposure is anticipated contact with blood or potentially infectious materials that may result from the performance of an employee's regular duties. Employees are especially vulnerable to transmission of diseases by the exposed areas of their body, namely skin, eyes, mucous membranes, or intravenous contact. Duties in which employees are vulnerable include street outreach, direct participant care, housing services, and waste management. Exposure can be limited by employing workplace safety protocols that reduce employee exposure, either by removing the hazard or isolating the worker. Examples include needle disposal containers, self-sheathing needles, and safer medical devices, such as needleless systems or other devices with injury protections engineered into them. Work practice controls are employee practices that can be used to reduce the likelihood of exposure by altering how a task is performed. Examples include washing hands after removing gloves and as soon as possible after exposure, not eating in the work area, and not smoking in the work area. When work practice controls are in place, but occupational exposure remains a concern, personal protective equipment is required. Employers are required to provide it at no cost to the employee. Personal protective equipment may include gloves, gowns, face shields or masks, eye protection, mouthpieces, pocket masks, or other ventilation devices. Hand hygiene is one of the most important work practice controls and a continuous challenge. Employers are expected to provide an alcohol-based hand cleanser in multiple locations. Employees should use it when their hands are not visibly dirty and soap and water aren't available. It is recommended that a good amount be used frequently throughout the course of the day. It should be continuously rubbed into all surfaces of the hands until it's completely dried. You should wash with soap and water when your hands are visibly dirty and after direct contact with potentially infectious material. Lathering and rinsing your hands should take about 20 to 30 seconds. Employees can take further steps to limit exposure, like maintaining a clean and sanitary work site, ensuring infected materials are cleaned sufficiently, and, when appropriate, disposed of safely. Contaminated sharps should be disposed of in a manner befitting regulated waste. Approved sharps containers should be used. They are required to be accessible, upright, and should not be overfilled. When removing a container, it should be closed immediately prior to removal and placed in a secondary container if leakage is possible. While sharps containers may be reusable, they should not be opened, emptied, or cleaned manually. All sites with a high volume of at-risk clients will be provided with a sharps disposal container. Human Resources must maintain a sharps injury log, and they should be given a list for each incident, including the type and brand of device involved, the department and work area affected, and how the incident happened. If needed, ask a supervisor where the local needle exchange sites are located. Contaminated laundry should be handled as little as possible. It should be bagged or containerized at the location where it was used. Containers should be labeled or color-coded as well as leak-proof. Employers must ensure that employees who have contact with contaminated laundry are provided the appropriate personal protective equipment, including protective gloves. Contaminated laundry should be shipped to an off-site facility. Employers are required to adequately communicate occupational hazards to their employees. Labels, signs, information, and education are all tools used to do so. Employees should receive such training at the beginning of their assignment, with a training to refresh their memory provided at least annually or whenever changes occur. Training materials should be accessible to all employees. Information and education surrounding bloodborne pathogens should be provided to all employees who may be at risk for exposure at no cost. If you would like to further research the minimum requirements, OSHA outlines them in CFR 1910.1030. Section G2.7 specifically details the requirements of training programs. In this unit, we have defined what a bloodborne pathogen is and acquainted you with the best practices required to minimize your risk of exposure. We have reviewed OSHA standards relating to bloodborne pathogens, as well as their requirements of employers. Your attention to this unit and adherence to best practices will help to keep you safe when performing duties that may expose you to bloodborne pathogens.